I've
Is there an
adjusted a
age limit?
98-year-old person.
Wow.
So there are not any age limits, and he was on hospice care, and I helped him to be more comfortable
Oh, that's
before he
wonderful.
passed. But as far as osteoporosis goes, again, if we can keep someone moving, and I've got like a vibration plate that can help strengthen that, because the bone or the body will lay down bone in lines of stress. And so the body needs to be stressed out a little bit. But they're doing a research study right now with the Activator. Somehow they have osteoporotic rats that they can work on because they want to see how things are. And they actually found that in the rats that were getting adjusted with the Activator, in those areas, they started to show more bone strength. So
Wow.
they're starting to get an FDA clearance that chiropractic, or through the Activator Methods technique, that it can help in areas of osteoporosis.
Hey there, rebels on the retirement highway. I'm Cindy.
And I'm Yasmine, your co-pilot for fun flashbacks, retirement mischiefs, and the occasional Medicare sanity check.
We're best friends, lifelong storytellers, and just noisy enough to share what we've learned about life. Laughter and staying retired, rewired, and slightly unsupervised.
Your co-pilot for fun flashbacks and retirement mischief. Each week, we start off with a blast from the past and connect it to real life now and sprinkle in some Medicare truth, minus the boring parts.
Think Thelma and Louise with more giggles, less cliffs, and no Cousin Larry explaining Plan G.
So buckle up and hit subscribe. Your Medicare Besties are here to keep your retirement stories rolling and your Medicare mistakes in the rearview mirror.
Let's get started.
Hi, good morning, Medicare Besties. I'm here today, a little special treat. I actually have Dr. Bradshaw, who is a chiropractic physician, here today to talk to us a little bit about, we're talking about Medicare and how chiropractic is covered or not covered, and also some of the benefits of chiropractic care as a wellness tool in your artillery. Artillery. I'm not saying it correctly, I don't think. Anyway, Dr. Bradshaw and I are both in Utah, and I've gone to see Dr. Shaw a number of times, and it's been for a number of different reasons, for my jaw, for my carpal tunnel, for, the long days sitting at the computer. And so I asked if he would come in and talk about some of the benefits and some of the concerns that I've heard, and we're going to just get to know Dr. Bradshaw and a little bit more about chiropractic and your healthcare. Good morning, Dr. Bradshaw.
Good morning.
Why don't you let us know a little bit about you and tell folks about your background in terms of how you've come to where you are today, and a little bit about chiropractic for those that may not know exactly what it is.
Okay. So how I got into chiropractic is several years back. I was working like at a greenhouse. I was lifting heavy things and stuff. Then I went home one day and I just went to pick up my daughter off the floor. She was a little baby, 12 pounds, and should not have caused a problem, but my back locked up. I looked like a 90-year-old man without a walker. I was bent, hunched over. I could not straighten up. And I was trying to figure out, okay, what do I do to take care of this? And at the time I was a student in college, and the student health center, every time I went somewhere, I went there for something, I went in for a cough even, and they prescribed Vicodin. And I'm like, I'm not going to take Vicodin. Why would you give me Vicodin for a cough? And, I questioned the doctor on it, and they said, well, if you go home and you get a really good night's sleep, then your lungs can rest and the cough can go down. But I said, I'm not going to take this. And well, that's what I'm prescribing. And I've never been the person to be super reliant on like medications and stuff. And I'm trying to figure out, okay, where do I go? What do I do? And one of my church leaders was a chiropractor. And I had stereotypes about chiropractors, like a lot of people have, running through my head. But I knew that my church leader was an honest man, that I could trust him, and he offered student discounts. So I go in and I start seeing him, and my low back starts feeling a little bit better. It's taking some time. Okay, I'm getting improvements, but I noticed my headaches are going away. I'm breathing better. Like my asthma wasn't having as many problems. So I'm like, okay, this is interesting. And one morning, my wife woke up and she had left-sided chest pain that radiated into her arm, shortness of breath. She had all of the classic symptoms of like a heart attack or a heart issue going on. Take her to the ER. They run all of the tests and everything comes back negative. They said, you have unexplained angina pectoris. We don't know what's causing it. Have a good day. Well, that doesn't take away her pain. That didn't help her figure out what was going on.
Wow.
She knew something was going on. And we went to the chiropractor later on that day for my visit. She wanted to stay close to me because she was nervous about stuff. And he said, well, so what's going on? And we told him, and he was like, oh, I bet you have a rib out of place. We're like, what? He's like, oh, well, when ribs
Whoa.
go out of place in the front, they can mimic all signs of a heart attack. Now, yes, if you are having all of those symptoms, get checked out first. Make sure your heart's okay. But if
Sure.
it still consists, it could be a rib out of place in the front. Anyways, back to the story. My wife filled out the paperwork. She had never been adjusted before. And, she went from pain. And after that first adjustment, watching her go, I can
Wow.
breathe, I can move. And it took her a few adjustments to get the pain to go away, but it did clear up. And this doctor, this chiropractor, used his hands to clear up something that the ER doctors had no clue how to touch. And
That's
then
amazing.
fast forward a couple of weeks, my daughter was having a lot of ear infections. Again, just a little baby. And the doctor tried one round of antibiotics, didn't touch it. Second round of antibiotics, we were halfway through, go in on a Monday, and they said, so what's, or go in on Monday, and the pediatrician said, her ears are still angry red. Let's give the antibiotics a couple more days to work. And then if, bring her back in on Wednesday. And if it's not cleared up, I want to put tubes in her ears. And at this point, my daughter had already had like 3 surgeries. She had a lot of struggles as a baby.
Oh my gosh. Yeah.
And so we're like, oh my gosh, another surgery. What are we going to do? And the next day, went to the chiropractor. And again, he was very, very in tune with things going on. And you could tell that we were frustrated. And we told him what was going on. He was like, would you allow me to adjust your baby? And we're like, okay. And he was a manual
Yeah.
adjusting chiropractor. So there was the twisting and popping. I'm like, you want to take my baby's neck and do that? And he explained that for a baby and infants, it is very, very gentle. The amount of pressure you would put on your own eye without causing pain, or on a ripe tomato and without causing an indent. And so it's like, okay, well, he's already taking care of me. He's taking care of my wife. Okay, go ahead and adjust my baby. Well, he explained that if the bones are out in the top of the neck, that it can tighten the muscles inside the throat and not allow the ears to drain. So especially in the top area of
Interesting.
the neck. And so we allowed him to adjust her, and it was all gentle, very, very low force. And he got to the top bone in her neck, and she fidgeted quite a bit. You could tell she was uncomfortable. And then all of a sudden you just see her relax. And
Oh my
that night she
gosh.
slept through the night. And then we went to the pediatrician the next day, and he looked in her ears and he said, the antibiotics must have worked. Her ears are 100% clear. I don't have to put tubes in her ears. And we're like, well, we took her to the chiropractor, and you never take a baby to the chiropractor. Are you stupid? Pretty
Yeah, yeah.
much. But it's like, okay, but the chiropractor helped her ear infections overnight, helped my wife with her pain. It was helping me with all of this stuff. And he's using his hands. And I was thinking about it at this point. I'm like, okay, so what would I have to do to be a chiropractor? And,
Yes,
you know,
it was your moment. I love
that was
that.
my why moment, that I saw how it affected me, how it affected my wife, and how it affected my baby. And it was like, okay, this is what I want to do. Before then, I was bouncing back and forth. I had no idea, no firm direction in life. But once I decided I wanted to be a chiropractor, nothing stopped me. So
Wow, that's amazing. I have a little story to tell you about my first chiropractic experience. I was getting married in my 30s and having doubts about the wedding about 6 weeks before, where I really sort of wondered if I was making a mistake. And at the course of in that time that the invitations had gone out, there was like, we were all in, right? Well, 2 days before the wedding, and I thought that I'd kind of reconciled some of those as jitter or whatever. But 2 days before the wedding, and I had nothing. It wasn't even go pick up a baby or anything. I got up in the morning and I couldn't get out of bed. I was literally like my back had locked up or whatever. I don't know. And so my neighbor across the street said, I go to a no force chiropractor. I'm going to see if I can get you an appointment today. And at first I was like, I don't even know what a chiropractor does versus a force chiropractor. And so I was like, okay, I'm game. What am I supposed to do? I'm supposed to get married in 2 days. And sure enough, I went and I was hunched over, like I could not move. And whatever she did in terms of those pressure points and what have you, I walked out of there walking. And then the next day, I woke up again, completely crunched over, and saw her again a second time. And I've never had that happen again. And I'm curious from your perspective. I really think it was stress potentially, but I just found it psychologically interesting that 2 days before a marriage that which ultimately did end in divorce, but one that I'm not sure about, I would behave in such a way 2 days before that. never happened again, never before. What do you think of that? Is there some sort of mind brain body connection that with chiropractic we kind of help to sort of remove some of that, physical stress that might be we're not aware of? Or I'm just curious.
Yeah, absolutely. We talk in chiropractic school that there are three causes of what we call a subluxation, which is when a joint goes out of its alignment and creates inflammation around a nerve and creates dysfunction somewhere in the body. But we talk that our thoughts can do it. So being stressed out, and a lot of times when people are stressed out, muscles are tight, they're holding on
Yeah.
to all of this stuff, um, and it can pull the bones out of place. And your body has a hard time when it is so stressed out, when you're in fight or flight mode, to try to break loose of that. So our thoughts can do it, trauma, auto accidents, slips and falls, and then toxins, the things we eat, the air we breathe, and stuff like that. Those can also affect and create these subluxations in the body where something is impeding the nerve signal to and from the brain. Chiropractic adjustments, especially like to the neck and low back, can help reduce stress. They activate the parasympathetic nervous system, the rest and digest, where the sympathetic is the fight or flight. And so, your body's always like, but we can balance out the nervous system. And so then people are able to relax and focus better.
Yeah, totally makes sense. I've been seeing you recently because of my jaw, issues, and I had that trauma dental work last year, and I finally have all my teeth back. That I had this missing one from the implant, and it was finally installed. And I had just seen you for the jaw, and it's really funny because I have just with the two times that you've adjusted me there, I feel like you step back to the stress again. I think it was the stress of always eating on one side of my mouth, feeling weird about not having this major tooth missing and everything. But you mentioned subluxation, and so I wanted to kind of go in that because as you know, as a Medicare agent, I'm talking to people about Medicare benefits, and if I go into the Medicare, people go, well, I want to see a chiropractor. What does Medicare cover? And you go in there, and it's like this terminology. I should have had it up right now, but it's basically we cover acute need for therapy on subluxation of the spine. And so if I tell this to somebody, subluxation of the spine, I myself don't really understand exactly what that means, but I know it's related to the spine. But in talking to you, you had some thoughts about that and actually have chosen not to necessarily take Medicare insurance because of some of those limitations.
Yeah.
And I thought it'd be great to talk about that a little bit. First of all, so you can give me the elevator grandma style definition of subluxation of the spine that I can use with my
Yeah.
clients.
So again, with the spine, when one of the vertebrae of the spine gets misaligned and again creates inflammation on the nerve, doesn't mean that it is pinching the nerve. Like if there's degeneration or something, then it can actually pinch the nerve. But just going out of place enough that it creates inflammation around that, then anything that nerve goes to can experience dysfunction or pain. So subluxation of the spine is when any of the vertebral bones go out of their position and create problems. Now, the Medicare wording says subluxation of the spine, but your feet can go out, your jaw can go out, knees, hips, shoulders. So they're saying pretty much that they will cover acute injury to the spine, but there's so many other parts of the body that can be adjusted as well to help people to be more comfortable. But again, it only covers acute issues. You have a certain issue that just came up, and as long as you're getting some improvement, then they say, okay, but once they feel like you've switched into maintenance, they won't cover it anymore. They
Correct. Yeah.
also, they will not cover exams. They will not cover x-rays. They will not cover massage therapy, acupuncture, other services prescribed by a chiropractor. So they almost like require us to have it, but they won't pay for it. They will pay for the adjustment only of subluxation of a segment of the spine. And
Got it.
so all of these other issues. So I don't have an X-ray unit in my clinic. And if I wanted to send one of my Medicare age patients to one of the imaging centers, again, I cannot order that X-ray and have it paid and covered by Medicare. They have to go back to their medical doctor and have an order put in, and then Medicare pays for that just fine, but they won't order an X-ray, but they require X-rays from chiropractors in most cases to adjust somebody. So it's very
Yeah. And
frustrating to deal with.
it is very frustrating, and it's gotten a little bit more strict in terms of that adherence to those guidelines around it being an acute, okay, kind of like my situation. Okay, two times you couldn't get up, and now it's fixed. We don't want to see you again. Where maybe I was
Yep.
probably in a world of stress that I could have used a little bit more treatment at the time. So, I've had clients get really frustrated with that. So, why don't you explain a little bit? Because it's not clear to me also as when is something a situation where you may want to go see a chiropractic for a few sessions versus where sometimes maintenance or a little bit more routine preventative sessions would be of value.
Okay. So yeah, of course, anytime that
Because
you are actively like hurting, something in the body is hurt, feels like something's out of place, those can definitely benefit. But like I said, it can affect the nerves that go to your bowel and bladder. It affects the nerves that can go to your lungs and heart. So sometimes you might be having some visceral or organ issues that just don't seem to clear up, that could be coming from the spine. But so
interesting.
typically we need to see people a little bit more often when they're in acute pain, or sometimes if they've dealt with chronic pain for a long time that we're trying to get rid of that, then it takes a few visits. But in my office, it's a no pressure like situation. I'm going to tell you what I think, but I'm going to listen to your body. If in between day one and you come 3 days later and you haven't been feeling as much pain, okay, the next time I want to try 5 days out. I want to try 6 days out. I want to see how long your body can hold those adjustments instead of jumping to the standard. I want to see every day for the rest of this week and 3 times a week for the next 6 weeks, which is a pretty standard treatment plan for chiropractors to offer. But I want to see what your body's doing and I want to see how it's holding. Like coming in periodically for maintenance once a month, every couple of months, just like you have to do maintenance on your car, you have to take maintenance on your spine. You only have one spine, you can't get a new one.
Yes.
And so you need to periodically take care of it before things become a problem.
That makes sense. And from your perspective, I know when you talk about the different scenarios, like with your wife, and which would never occur to me that a chiropractic solution would have been available, or your baby. What are some tips that you have for those that are 65 and plus that are on Medicare in terms of what they may be? We're always taught like, okay, you're going to get older, you're going to be a little bit more hunched over, things are going to start to hurt. Even myself, I'm 59 now. I kind of even mentally will say, well, I guess I'm not as young as I used to be. What are some tips that you have for those that are 65 and over in terms of spinal health or ways in which they can live their best life, in terms of their
Yeah.
self-care?
So being able to get up and move around, of course, is always a good thing. Motion is life. And as long as joints are moving, the body continues to maintain them. Now, sometimes those joints get more wear and tear if we are overweight or having like other issues, which again puts more wear and tear on the knees and on the hips, uh, leading to things. But a lot of times, people are like, oh, well, it's age-related degeneration. Well, all of the joints in your body are the same age. And yet I can look at an x-ray of a 90-year-old man and see some that have perfect disc heights, no degeneration forming. But
Interesting.
then you look at the next one and it looks like it's all like jammed together and there's nothing left of it. So what's causing that is the joints that aren't moving, the ones that have been stuck for a long time. The body's like, why, if this joint's not going to use or be used, why am I wasting energy maintaining it? I'd rather fuse it. So that's when like degeneration
Interesting.
starts forming. But if the degeneration just barely starts and we can start adjusting it and getting it moving, then the degeneration will either slow down or stop. But again, all of your joints are the same. So it's not an age related thing. It's something's been stuck for a long time.
It makes sense. I mean, I was
The
just
accident
thinking,
themselves when they were young and they didn't know.
yeah, except for maybe the yogis, the people that are doing yoga all the time. Most of us don't. I mean, my mom used to actually wake up and first thing she did, and she was in her 80s doing this. She'd come visit, and I go, "What are you doing?" And she'd be sitting in the guest bedroom and moving her legs up and down and her arms in circles and doing all kinds of stretching. And it never really dawned on me. But what you're saying is actually probably things that made her capable of walking and being active well into her 80s that other people may not be if we're basically, couch potatoes, if we're just being
Yeah.
a little bit more. I even myself, like I spend all day, on the computer, and now I'm trying to put a little alarm that says every 45, minutes, stop
Yep.
and, twist my neck and do a little bit of stretch or something. So
Yes.
I can understand. What are some of the, what's interesting to me about your wife's story specifically, and even your daughters with the ear infection, that just blows my mind, is what are some areas of where you've treated people that you wouldn't normally, like we normally correlate or think about chiropractic with like, back issues or maybe neck
Yeah.
issues. But what are some of these other anecdotal things that, because I do meet customers of mine that will come to me and say, I'm so frustrated. I've had this particular set of symptoms, and my doctor keeps telling me that there's nothing wrong with me, or that it's not a big deal, or what have you. And they feel like there's this undiagnosed sort of situation going on with them. And so I'm just kind of trying to figure out, is it one of those things where it's possible that it takes just a different type of doctor, like a chiropractic doctor, to potentially isolate and determine what could be done?
That's been what I've noticed, that there's a lot of people that, they are frustrated with their healthcare. They don't feel like they're getting anywhere. My wife went through a lot of different doctor's appointments trying to figure out, she knew something was wrong with her body and was not able to be figured out. But then we all of a sudden she gets relief through the chiropractic care, just having
Yeah.
someone else look at it. But, if you go into a medical doctor and you say, okay, my shoulder hurts, they might x-ray or MRI the shoulder, but they are focused right there on the shoulder. And when you come into me, I'm thinking, okay, could your wrist be causing it? Could your elbow be causing it? Could it be because the nerves from your neck go down into your shoulder? If that's pinched, this isn't going to heal properly, or possibly isn't going to heal properly because the nerves aren't communicating properly through that. And so there are a lot of times that when we're looking at the whole body approach, adjusting someone's low back and balancing out their pelvis, and their headaches start to go away, that everything in the body is connected. And so we just want to make sure that everything is moving. And again, not just focusing right where my pain's right there, not just focusing right there. What else is connected to that? Okay, the clavicle could be out right here, which is causing this pain right there.
Yeah, totally makes sense. Yeah, when I lived in Germany, they do a little bit of Western with homeopathic, sometimes naturopathic, but it seems like somebody, MD, had some other sort of specialty that they aligned with it. Even my dentist there, I remember having some another dental thing, and I was kind of like had my mouth open for a long time. And I was gagging. She goes, "Oh, you're kind of gagging. Hold on a second." She grabbed an acupuncture needle, put it somewhere in this area of my body. I don't know, and immediately the gag reflex went away completely.
Yeah.
But I say that because my primary care at the time was also a naturopath, and so she described the body in a way that I think you are, which she said Western medicine, if you have like a balloon is your body full of water, a Western medicine doctor sort of looks at where's it leaking and we try to band-aid that, let's go
Yep.
fix that leak. Where it sounds like chiropractic, and the view of my old primary care physician there was, we want to know, why is the balloon full of water? How is it as a whole? Let's
Yep.
like, why is it leaking to begin with? And I think that that really hit me, as a very different way of looking at, fixing a problem versus understanding why is the problem there to begin with.
Yeah.
And it sounds like that's what you're doing.
Well, and I like to throw out the analogy sometimes that one of my teachers told me at school, that you don't get a headache because you are lacking ibuprofen or acetaminophen in your bloodstream.
It's a great way of looking at it. Never thought of it that way.
The headache is your body's checking, something is going on, something's
Yeah.
causing it. Sometimes it's allergies. Here in the Salt Lake Valley, quite often it's allergies in the front. But if the muscles back here are tight, then it gives those pulling type headaches. If your jaw's out of place, it can cause headaches as well. Certain areas in the neck are related to headaches. So depending on what type of headache you have. But again, there's several things that could be going on. But what we're taught in Western is, if you have a headache, go take some
Here's
ibuprofen,
your
go take some
prescription.
Tylenol.
Exactly.
But again, it's not because we are lacking that in our bloodstream that we have the stuff that, just like you said, puts a band-aid over a hole in the balloon and just covers it up.
Yeah. No, I love that. Well, and then, a lot of people, like you said, have this view of like, the cracking of the back and all these things when they think of
Yep.
a chiropractor, and get kind of nervous about it. And especially as you get older, a lot of my clients also have osteoporosis, or they're just worried about being a little bit more frail. And when you treat me, you don't even do any manual manipulation. You use something called, I think it's I always forget, activator, actuator,
Activate.
something,
Uh-huh.
activator. And so I thought it'd be great to kind of talk about that a little bit, because as I get older, I think I am more worried about somebody could actually really hurt me if I was, manipulated manually. And this particular device is really pretty cool. And I'm sure most people have never even heard of it. So I thought,
Yeah.
why don't you tell us a little bit about that?
Okay. So a lot of people have seen an activator that looks similar to this, or metal at their chiropractor's office, but it's a spring-loaded instrument that gives a very direct, specific thrust to the body, and it can also be changed in strength. I use an electric one in the clinic that low back and hips. Now it sounds louder than it is, but it's hardly moving my finger.
Yeah.
But then your neck, just a gentle little pressure. And if I'm doing a baby, just a gentle low pressure through my finger. But I can adjust the body very, very specifically where and how it needs it without the twisting and popping. Activator's been around for a long time, but there's actually a technique that goes with the activator called the Activator Methods technique. And it was developed over 60 years ago, and they're still constantly trying to improve it. It's got so many different like FDA clearances and stuff like that. It is the most researched technique out there, but the most researched instrument for adjusting out there as well. But how the technique works is it's based off of like a leg length analysis. And so if you come in and your leg appears, I say appears because it doesn't mean it's physiologically short, but it can be shortened if your pelvis is out of place. And so if your pelvis goes out of place, like if the right side rocks backwards, then the hip on that side goes forward and up, the other one down and back, giving the appearance of a short leg. But once we adjust the pelvis, then the legs can align. But then by having people do different movements, like a hand behind the back or arm up alongside the head, it will single out specific vertebra in the spine and let me know exactly how to adjust it. And there's many times as an activator chiropractor that I've unlocked things that other chiropractors haven't been able to unlock. Because a lot of times with manual adjusting, we are looking for a lot of like rotations. And so we're taking the rotation and we're putting it back into place.
And it's like it's almost on your back, like you're just like you said about your baby. It's also you just said, the kind
Yeah.
of like you didn't even realize that you were not, in that comfort zone.
Yeah. But not only can the vertebra rotate, it can get pushed upwards, pushed downwards. The whole vertebra can shift sideways, or these little joints on the very back called the facets can get jammed
Yeah.
up. So I'm not just looking as far as like rotations, I'm looking to see which direction it could be out. There's like 4 different directions that it could go. And so there's, especially like with the facets, I've cleared out chronic low back pain that people have I had one guy tell me that he's been to 14 different chiropractors over the last 20 years because his wife's been in BNI, and every time they get a new chiropractor in the group, then she has her husband go and check him out. But he's like, I've been in this pain for such a long time. Old cowboy, loves to ride his horses, stubborn. Oh man, I found that he had his facets jammed up. And so I was able to unlock something in his low back with the facets that after 2 visits, he was like, Doc, I don't know what you did, and I'm surprised you did it with your little clicky thing, but the pain I've had for 14, 15 years is gone.
Wow.
And I will come back to you when I'm hurting again.
That's
so
amazing.
14 years of chiropractic adjustments and trying all of this manual stuff. And in a couple of adjustments with the activator, I cleared it up for it. Because I listened
And
to
I'm
his
also
body. His
surprised
body
how
told me.
quick it is. Yeah, it's also a very fast procedure. Like, for you to be able to kind of isolate
Yep.
what's going on and do this, it's like it's an in and out. For someone who isn't sure about chiropractic, is it one of those things like within a visit that they may be able to see whether it is something that has helped them in terms of will they leave there? I feel like I usually leave there feeling, after 12 hours at the computer or whatever, like, okay, like you've just allowed my body to finally say, relax a little bit.
So my goal when you leave my office every time is that you feel at least a little bit better than when you walked in. Some
Yeah.
misalignments take a while to fix. There's other times and I love it that people feel a ton better before they leave the office. If they get off the table and they're like, it still just hurts right here. While they're standing, I can feel there and go, okay, something is still tight there. Adjust it with the activator while they're standing. They're like, oh, wait, now it's gone. So I have so many of those, wow, aha moments in my clinic. And again, I get people feeling better really, really quickly. And they don't have to come back as often. Where when I worked for a previous chiropractor and I was adjusting manually, some of them needed to come in 3 or 4 times a week because their pain just was taking a long time to go away. So I can still do the manual adjusting. I just get far superior results and quicker results for the patients with the activator. And I'm doing it in a gentle, low force way. So it baffles people's minds when I'm like, okay, those 6 clicks I did the same thing as laying you on your side, twisting you up like a pretzel and getting loud pop out of your low back. And I cleared it up with a few clicks. And they're like, so that little clicky thing, they always call it the clicky thing or actuator or
Yeah.
whatever. It actually does do something. Okay.
Yeah. I agree. I mean, I think that that was, I was really, I wouldn't say skeptical, but I was like, really, I'm not really sure what this will do. And I actually love the fact that it's, not something that I need to, plan a long visit for, but also that I feel, immediately some tension and, like that, I don't know what you would call it, but that feeling like you're totally cramped up, so to
Yeah,
speak.
the tension.
Tense is starting to go away. But I would say though that when I hear the stories about how you've helped people, back to your why in the beginning, any regrets from your chosen profession? It just feels like you could go home every day and know what you're doing is good in the world.
I know that what I'm doing is good in the world. Again, I'm not the pushy type of chiropractor. I was trained to be that, and I did not enjoy it. And I felt like I had to talk people into coming 20 visits in the first 6 weeks. And so then when I went out on my own, I'm like, like I mentioned earlier, let's listen to the body and let's do it. Again, I get people feeling better really, really quickly. And then all of a sudden they don't show up to their appointment or they're like, okay, yeah, I'll schedule like a few weeks out, but I don't know my schedule yet. So I'll give you a call. And then they don't come back until they're like hurting again. So I'm constantly
Mhm.
looking for new patients in my office because I'm really good at getting people out of pain, but I need to work on talking to them a little bit more about the importance of maintenance. But in today's busy
Yeah.
world, again, it's hard for someone to say, "Oh, I'll schedule a month out," and remember that.
And then life happens. Exactly. Any last words that you have regarding Medicare related chiropractic needs, and especially like those maybe with osteoporosis or very frail folks? What would be the oldest person that you would potentially see?
I've
Is there an
adjusted a
age limit?
98-year-old person,
Wow.
so there are not any age limits, and he was on hospice care, and I helped him to be more comfortable,
Oh,
um,
that's
before he
wonderful.
passed. But as far as osteoporosis goes, again, if we can keep someone moving, and I've got like a vibration plate that can help strengthen that because the bone or the body will lay down bone in lines of stress. And so the body needs to be stressed out a little bit. But they're doing a research study right now with the activator. Somehow they have osteoporotic rats that they can work on because they want to see how things are. And they actually found that in the rats that were getting adjusted with the activator in those areas, they started to show more bone strength. So
Wow.
they're starting to get an FDA clearance that chiropractic or through the activator methods technique that it can help in areas of osteoporosis. And so, but yeah, I'm not worried because I'm not twisting and popping anybody. I'm not worried that
Right.
I'm hurt anyone with osteoporosis. So the people who are nervous about going to a chiropractor, I'm the safe place typically to come to, and I can still help them unless their bones are so brittle that you barely touch them. And there are some people that have that. And okay, don't
Right.
come into my office if you're having that, But yeah, there's a lot of things that we can help with. My cold laser can help with arthritis type pain and help with stuff like that. So
And so, Dr. Shaw, I think you also mentioned to me that you might have a special offer for those that are in the Salt Lake area and would want to try your services for Medicare patients.
yeah. So first of all, with the like Medicare rates for the acute care, Medicare typically covers 80% of the costs, and they determine that the cost of a chiropractic adjustment should be about um, like $60. So they will pay, I believe it's like
Usually
$12 for your
80%.
first few visits. After that, your visits go up to 48 um, for like maintenance and for future care. What I offer in my office is the adjustments are $45 a piece straight through. So yeah, for the first few visits that you would be getting the discount, it's a little bit more. But then after that, I am below the Medicare rate, where my normal rate is 55. I'm doing it for 45 for my Medicare age patients to keep it down there to what their copay would be if they were using their insurance.
Well, I appreciate that. Thank you so much because it sounds like also from my clients that they're frustrated that even when Medicare, that what they need to see a chiropractor for, Medicare's not going to cover anyway.
Yep.
Back to that subluxation of the spine and acute back pain or what have you. So that's very helpful. And I think that could give some folks an opportunity to say, maybe, with $45, you look at a visit and see if this is something that might make them feel a lot better, and potentially keep them out of
Yep.
the specialist visits, which are, anywhere from $40 to $55, so,
Yep.
as a copay. So I
Well, and
appreciate
again,
you
if we could keep
sharing that.
them moving and doing stuff, it's great. And there are programs out there at
Yeah.
local gyms for senior sneakers that they get a discount. The Medicare will pay for that. It'll pay for them to go to the
Yes.
gym and even like get a personal trainer, but they won't cover for a chiropractor to balance you out so you won't slip and fall as easily. So you won't, or you'll be able to catch yourself before you fall. If they helped with those
Or
maintenance
maybe
type
you don't
things,
even go to the gym at all because you are not feeling like your body's strong enough to go to the gym. So
yeah,
it could be that, let me get myself in good shape,
yes,
let my body feel strong enough to even enter the gym, and
yep,
with confidence. Well, super. Well, I appreciate that. I will also highlight that in the podcast again in some of the notes, and
yep,
hopefully some folks will come back and let me know what their experiences were like with the activator, and hopefully they're feeling better soon. Thanks so much, Dr. Shaw. Appreciate
yep,
you.
no problem.
If you're wondering if this could happen to me, the answer is yes. If you do not know what gaps to look for,
Join us for our free Medicare webinar, Buckle Up Buttercup, 5 Medicare Secrets for a Smooth Ride Through Retirement. We'll show you how to dodge costly surprises and stay confidently covered.
Seats fill fast. Click below to save your seat and bring your questions. We're ready when you are.